Hi everybody, my name is Jennifer Fenton. I'm the Executive Director here at the Equine Healing Collaborative, and I am here with one of our rescue horses named Doc, who's going to be talking to you about equine-assisted psychotherapy and what it is that we do here at the Equine Healing Collaborative. So equine-assisted psychotherapy is a therapeutic model that utilizes horses in order to help individuals suffering from mental health conditions remediate mental health symptoms. So horses have an amazing capacity to provide therapeutic value to individuals who are dealing with mental health issues. So a couple things that people actually get wrong about equine-assisted psychotherapy is the assumption that all we do is just kind of stand around and pet horses or hang out with horses, when in reality, what we're doing is we're doing several organized interventions that essentially are geared towards remediating specific mental health conditions. And so there's actually quite a bit of organization and clinical thought that goes into the process. A big, huge chunk of what we do is we teach clinicians about the personalities of the horse, how they can be utilized therapeutically, and what interventions that the horse may or may not be good at, and what strengths that they might bring to a particular session. And so with that information, the clinician will essentially pair the horse, the intervention, and the client clinical presentation to what's going on that particular day. And those are some of that's the decision-making process that is happening with the therapist. And then they conduct the intervention with the horse that they chose, again, and that is like directly geared at, remediating a mental health symptom. So, for example, this horse right here, this is Roger. He is also a rescue. And as you can see, he's quite playful and small, and he really brings a lot of connection to the therapeutic setting. So for example, I might have a child who's kind of struggling with like some social cues at school. And so I might actually use Roger because of the fact that he also struggles with social cues. So you can see I'm kind of like removing my hand and taking my hand away from him. You can see that like he doesn't really necessarily pick up on social cues. And so he might be good to work with a child who is struggling with that, because he's going to be working with that kid to try and help that child to kind of understand and read the social cues of other people. Oh, you're so cute. Yes, you are. Look at you. Well, I have practiced a lot in traditional settings. I have a significant history of practicing in that way. And I'm trained in several evidence-based practices. And I just never really felt like what I was doing was actually landing with my clients. Like, it kind of landed in the therapy session, but as far as like what they took with them and then started practicing out in their own lives, I just didn't really see people making a lot of like significant and meaningful change. And what I found is that horses, because they act as a metaphor for whatever it is that's happening with a client, is that the client actually gets to problem solve right then and there with the horse. And through that process, which is a somatic process, a somatic experiential process, through that process, what happens is that the client has the opportunity to actually practice some of these skills in the therapeutic setting with me right there. And so what that does is it gives them something meaningful and something that they remember to go out and be able to practice. Are you eating my microphone? Oh my God. You know, one of the things that I think is really important to differentiate from our program from other programs in the community or across the country is that when somebody comes to us for services, they're actually working with a licensed mental health professional. So these are individuals who have a 4-year degree, which is a bachelor's degree, and then they go on to get a master's degree, which is a 2-year degree, either in clinical psychology or clinical social work. And then they are required to get a significant amount of hours as a trainee or an intern. And then once that is done and completed, they then have to get about 3,000 hours for licensure. And that process also requires them to sit for 2 significant state exams. And so there's a level of professionalism that is brought to our work that I think is really important, again, to kind of distinguish our program from other programs. The other thing that's really important to understand is that a lot of the folks who we treat are individuals who do have diagnoses. So these are individuals with post-traumatic stress disorder, major depression, anxiety, social anxiety. We treat all of the mental health conditions. And so because of that, we're able to diagnose, develop a treatment plan, and then we're able to go ahead and treat whatever it is that might be ailing the individual. Oh, wow. I think if I had to say one thing that I wish people really understood about the work is, number one, how impactful it actually is, and how powerful it actually is. Typically when I do demonstrations or I'm kind of talking to people about equine-assisted psychotherapy and what we do out here, I actually invite them to come out for a demonstration. And the reason I do that is because I can talk about it, but until people actually see it and see how the horses respond in a very organic fashion to whatever it is that's happening around them, it's almost kind of hard to believe. I kind of joke and I say, like, sometimes people might think like I feel like I'm talking like a crazy person, because a lot of what I say sounds so almost like impossible and magical when you think about it. The way that the horses respond, they just intuitively know how to respond to whatever it is that the client needs. And in fact, I would say that a horse's intuition regarding what a client needs is significantly more than me or my own understanding about what's happening with a client. He says, I went to college for years. Yes. Yes. He says, I have a food mustache. He says, I have a food mustache. Kind of sense an individual's, Spencer, what are you doing?
I was just chewing on my boot.
Oh, did that feel good? Oh, my goodness. Oh, did you see his eye? He's got a little scritchy. There they go.
He ate it.
He ate the paper?
Yeah, he ate the paper.
Did you see that, Erica? He ate your paper.